Figuring out how to treat foot and ankle issues can be tricky, and having more than one option is always helpful. Dr. Andrew Carver is the owner of the Shockwave Center and Laser Nail Center in D.C., and he's here to tell us about common foot problems and ankle problems and how we can help treat them. Thank you for joining us, Dr. Carver.
Thank you for having me.
There are two major problems. We're going to talk about both of them, but what's the big one?
Well, nail fungus, believe it or not, kind of an ugly thing to talk about, but it's actually the most common problem in the human foot. 30% of the foot problems that come in to a podiatrist's office is nail infection, onychomycosis.
Wow. And yeah. I'm guessing people don't really want to talk about that in conversation.
People never want to talk about it. As a matter of fact, I had a patient yesterday who had a fairly young woman, very attractive woman, married, came in with nails that were just half an inch thick and just frightening looking a couple months ago, and they look great now. And I mentioned something about tell your friends, she's so happy, and no one tells their friends that they had fungal nails treated by a laser and it was cured. So it's kind of funny. People don't want to talk about it. Absolutely. In
this day and age, we can always Google when something doesn't look right on us. I know anytime I have something, I'm like, I wonder if that's okay. So after we've Googled and we know what we have, should we go like yourself or go to your GP? What do you recommend? How's the best way to start?
A general practitioner is a general practitioner. I mean, this is an age of specialization. Most general practitioners will just say leave it alone. It's the only infection on the human body that is left alone for sometimes a lifetime. So
get it checked out.
It's very difficult to treat. And now that we have these lasers and other things, which I add a few other things to the treatment, we can now beat it. Sometimes we can't get a perfect clear nail, but we can get a relatively nice looking nail comparatively where you're not embarrassed to wear sandals. That's the average person that comes into me said, I haven't worn sandals in 30 years. I'm so embarrassed. I don't like to go to the beach or the pool.
Well, let's talk about that treatment. What are we talking about here?
Basically, it's 3 laser treatments. I have a no-mirror laser, which I think, excuse me, is the laser of choice. It attaches to the nail for about 16 minutes. It's a little uncomfortable. There's a little bit of heat, but it's done 3 times over 2 months. And then I basically reduce the nail with a special instrument. I put patients on a topical, essentially for life to prevent recurrence. And sometimes I add a mini pulse of the pill, Lamisil, which is the pill that everyone's so afraid of.
Why are they afraid of it?
There's a lot of fear that it causes liver problems, but it's.
But if you're doing the mini pulses, you call
it's very, very safe, and it's a problem in 1 in a million patients.
Wow.
So.
Okay, so you were telling us about the laser, and you said there's mild pain. Scale of 1 to 10. Tell us what the pain's like, because people always worry about that.
Everyone's different, and some patients have no problem with it at all. Some patients feel it's very uncomfortable. The laser connection can be padded a little bit to prevent as much pain, some pain, but it's not severe pain. I mean, yeah, most patients tolerate it fine.
Excellent. So that's number 1, the number one problem, nail fungus. Number 2 is?
Number 2, heel pain.
Heel pain, okay.
Yeah. And that's called plantar fasciitis.
Oh, yes, I've heard of this.
Almost everybody gets it sometime in their life, believe it or not. We stood up on our back legs very recently as far as evolution is concerned. And the plantar fascia gets very tight. And there are some very conservative things to do, cushioned arch supports, and I have something called shockwave therapy in my office, which is sound waves. It was a lithotripsy. It was originally used to break up kidney stones, and we use it to basically loosen the fascia. And so surgery used to be the big thing for plantar fasciitis, and now we have a lot of conservative things that usually totally calms it down. And
what is the fascia? Is that a bone or is that a tendon?
The fascia is just a cord across the bottom of the arch, and every time the foot purchases the ground, it extends, and that cord gets taut, like a tug of war back at the heel bone.
Brings it back in,
So if you put something under the arch to prevent that extension of the foot, pronation it's called, generally it calms down with other various treatments such as shockwave or sometimes injections of cortisone.
A little bit of
to calm it down. There's a kind of a very usually the patient stands up in the morning because it swells at night and it's severely painful. That's sort of pathognomonic of plantar fasciitis. I stand up on it in the morning and I
you feel
can't stand
pain.
it. Yeah.
Okay. I feel like hiding my feet. I'm wearing 4-inch pumps right now, and I feel like...
Is that bad? You want to know if that's bad?
Yeah, is that bad?
You know, bunions, hammer
such
toes,
cute
all
shoes.
those things don't come from the shoes,
Okay.
first of all. You know, tribes people get bunions that never wore shoes in their lives. But they're irritated by shoes. So is a pump a bad thing? I mean, if you were to wear one all the time and you have pain, maybe you shouldn't. But generally speaking, as long as you mix your shoe wear up a little bit and wear a flat shoe and a comfortable shoe some of the time, you're okay.
So you're telling me to buy more shoes. Dr. Carver, I like you a lot.
a lot of the new fashion high, I mean, there's a fashion high heel that Nike makes, actually has air soles and things like that. So as wide a toe box as you can, and cushion, the more cushion you can put on a shoe, the better.
And people who want to find out more can get to you how?
Through my website.
Okay.
Yeah, I guess.
And you're offering a free consultation right now as well. So if you
Yes.
you like what
Just
you've heard,
to you.
I got my free consultation, but now I guess you can't do it.
No, we are offering a free consultation.
Great.
Yes.
Thank you so much for joining us and for explaining these things.
Thank you for having me.
You can wear those shoes, ladies. That's okay. But if you're having problems, you now know where to go. More Let's Talk Live is coming up. Stick with us right here.